The 6 common medications that can cause heart attacks. Did you know that the most dangerous items in your home might not be your cleaning supplies or tools, but are actually in your medicine cabinet? Although we trust medications to be safe since they're FDA approved and prescribed by doctors, the reality is sometimes more complicated. In today's video, we'll reveal 6 common medications that can cause heart attacks, including some you might be using right now for diabetes, pain relief, and even common colds. From the over-the-counter pills that we take without a second thought to prescriptions that millions rely on, you'll learn how these medications could be harming your heart health, often without any visible symptoms. Let's start with the most commonly used NSAIDs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are frequently used for pain relief and to control inflammation. This includes medications like ibuprofen, aspirin, and naproxen. Because they're sold over the counter and without prescription, it's easy to assume that they're completely safe, but they can pose significant health risks. NSAIDs work by inhibiting enzymes called COX-1 and COX-2, which reduce pain and inflammation. However, this inhibition can also lead to serious side effects. Blocking COX-1 can cause gastrointestinal issues due to reduced protection in the stomach lining, while inhibiting COX-2 has been linked to increased cardiovascular risks. This is because COX-2 produces substances that keep blood vessels clear and blood flowing smoothly. Therefore, when COX-2 is inhibited, there's a higher risk of blood clots, hypertension, and heart attacks. Several studies have highlighted these risks. One study in the prestigious Lancet journal showed that certain NSAIDs increased the risk of major cardiovascular events by about a third compared to placebo. Drugs like ibuprofen and diclofenac were associated with the highest risk. Naproxen still showed risk with long-term use but was generally considered safer for heart attack specifically. On the other hand, naproxen is more likely to cause gastrointestinal side effects like stomach ulcers and bleeding. As you can see, no drug is completely free from risk, especially at higher doses or when used long-term. That's why it's important to use these drugs only when necessary and at minimum doses. People with existing heart or liver conditions, or anyone taking other medications, should be especially cautious. Anti-inflammatories can interact with many medications, including common ones prescribed for heart disease, like antihypertensives, such as ACE inhibitors, anticoagulants, like warfarin, beta-blockers, digoxin, and even seemingly harmless ones like aspirin. So, talk to your doctor first. For anyone purchasing over-the-counter pain relievers without a prescription, the general rule is to avoid using them for more than 10 days unless advised by a doctor. And you know that annoying page of tiny text instructions? Read that and keep it with your medication. That's actually very important. When you take any medication, you're introducing powerful chemicals into your body, so it's crucial to follow dosage instructions accurately, understand potential interactions with food, alcohol, or other medications, and be aware of any side effects to watch for. Plus, the simple fact is that you know your body and medical history better than any doctor trying to serve you in 15 minutes. So, it's always best to stay informed, understand what you're putting in your body, and voice any concerns. Later, we'll discuss more common over-the-counter drugs to be cautious with, but at number 5, we have medications for erectile dysfunction. The most common type of ED medications are known as phosphodiesterase type 5, PDE5, inhibitors. Common forms include Viagra, Levitra, and Cialis. You may know that ED is often an early warning sign for heart disease. That's because conditions such as atherosclerosis, where your arteries become narrow and damaged, not only block blood flow to the heart, but also to the arms, legs, and sexual organs. PDE5 inhibitors promote vasodilation, relaxing the smooth muscles in the walls of the arteries, which allows more blood to flow through. This works wonders for sexual function, but the cardiovascular system is a finely tuned machine. When arteries open more than the body naturally expects, it can also impact blood pressure and overall cardiovascular function. For people with heart disease or hypertension, this vasodilatory effect of ED medications can strain the heart, especially if it's already weak. We've got another common medication that has a similar artery relaxing effect coming up shortly that everyone should be aware of. But first, PDE5 medications are also known to interact with nitrates, which are often prescribed for heart conditions. Again, This combination can lead to a significant drop in blood pressure, potentially triggering a heart attack. Next, heart disease and diabetes go hand in hand, but unfortunately, there are 3 commonly prescribed diabetes medications that can actually increase heart attack risk, yet are still available on the market. First, metformin. Metformin works in various ways to reduce blood sugar levels, decreasing glucose production in the liver, improving the body's response to insulin, and reducing glucose absorption in the gut. Quite impressive, really. But the problem is metformin can cause serious trouble if you have kidney problems, and an estimated 30 to 50% of type 2 diabetics have kidney disease, many without knowing it. The main concern here is a side effect called lactic acidosis. This happens when lactic acid builds up in your body faster than it can be removed. Normally, your liver converts lactate into glucose, but when metformin inhibits this pathway, lactate accumulates. If lactic acidosis occurs, it can lead to muscle pain, trouble breathing, and even cardiac arrest. Similar to metformin, thiazolidinedione-based medications enhance the body's sensitivity to insulin. They achieve this by increasing the sensitivity of muscle, fat, and liver cells to insulin, enabling these cells to remove glucose from the blood more effectively. While effective in controlling blood sugar, thiazolidinediones can cause fluid retention. Fluid retention increases the volume of blood that the heart needs to manage, and for a weak heart, this extra workload can exacerbate symptoms like shortness of breath, swelling in the legs, and fatigue, as well as increasing the risk of heart attacks. Our third diabetes medication to be cautious about is dipeptidyl peptidase 4, DPP-4, inhibitors. Common types include sitagliptin, saxagliptin, and linagliptin. These medications increase insulin secretion. However, numerous studies have found an increased risk of heart failure associated with DPP-4 inhibitors. Researchers from the University of South Australia reviewed 9 different sets of data and found a 15% increase in the risk of heart failure in people taking DPP-4 inhibitors. If you're taking any of these medications and have concerns, talk to your doctor about possibly switching. There may be better alternatives, but there could also be valid reasons why you're currently prescribed metformin, thiazolidinediones, or DPP-4 inhibitors. Of course, naturally reducing the need for these medications is the most ideal solution. Next, decongestant nasal sprays are another unsuspecting culprit that can potentially increase the risk of heart attack. Studies show that decongestants like pseudoephedrine can raise systolic blood pressure, which exacerbates underlying heart conditions and can trigger cardiac events. Additionally, decongestants interact with many medications and health conditions, potentially increasing the risk of arrhythmias, hypertension, palpitations, and tachycardia. Overuse of decongestant nasal sprays can also lead to a condition called rebound rhinitis, where congestion worsens once the decongestant wears off, making them less effective over the long term. It's crucial to be cautious with decongestants, especially if you have heart disease, high blood pressure, thyroid disease, diabetes, or any other health condition. Talk to your doctor first and investigate how the chemicals you're ingesting may interact with other medications or health conditions. Next, tricyclic antidepressants, TCAs. These drugs, primarily used to treat depression, can increase the risk of heart attacks due to their impact on cardiac electrical activity. TCAs block the reuptake of neurotransmitters like norepinephrine and serotonin, which alleviates mood symptoms but also affects cardiac ion channels. This action can lead to disturbances in heart rhythm, such as tachycardia, where the heart beats faster than normal. Tachycardia strains the heart, increasing the demand for oxygen while reducing the time the heart has to fill with blood, ultimately heightening the risk of heart complications. Research has shown that the use of TCAs can also lead to cardiomyopathy, a condition where the heart muscle becomes enlarged, thick, or rigid, increasing the risk of heart failure. In comparison, selective serotonin reuptake inhibitors, SSRIs, a newer class of antidepressants, are generally considered safer. SSRIs selectively inhibit the reuptake of serotonin without significantly affecting other neurotransmitters or ion channels, which minimizes their cardiovascular effects. That said, both TCAs and SSRIs can interact with other medications, particularly those that also influence serotonin levels, like anti-nausea medications, triptans, mood stabilizers, and opioids. St. John's wort is a popular herbal supplement that can be purchased without a prescription. However, it can also interfere with these drugs, significantly increasing heart attack risk. So, as always, consult with a healthcare provider before starting any new treatment, including herbal supplements. And at number 1, we have diltiazem. Diltiazem is a calcium channel blocker used to treat high blood pressure and angina, chest pain. It works by relaxing blood vessels and slowing the heart rate, improving blood flow and lowering blood pressure. A significant concern with diltiazem is its negative inotropic effect, meaning it can weaken the heart's contractions. This can cause an abnormally slow heart rate, especially in those with pre-existing heart conditions. Diltiazem has also been associated with rare instances of liver injury, which is less common but extremely serious. Diltiazem is not typically a first-line option for managing high blood pressure, so if your doctor has prescribed diltiazem before trying other options, you might consider having another conversation with them or seeking a second opinion. And, of course, aiming to avoid or reduce medication dependence is the best approach because all medications come with side effects. Thanks for watching. If you found this video informative, please give it a thumbs up and share it with your friends and family to spread the word about these common medications. Don't forget to hit the subscribe button and turn on the notification bell so you never miss an update from us. If you have any questions or experiences with these medications, leave a comment below. We'd love to hear from you. For more detailed information and additional tips on maintaining heart health, check out the links in the description box. Stay informed, stay safe, and take care of your heart. See you in the next video.